capsular cars are a great way to get a better connection to your ankle, especially in inversion and eversion, which are these movements here, inversion and eversion. It's really important to prioritize those movements first if you have any sort of ankle mobility restrictions in plantar flexion, which is pointing your toe, or dorsiflexion, which is bringing your foot up. We want to make sure we clear rotation first, and capsular cars are a great way to work on that. And they're a great way to begin to understand what muscles are doing those movements, so then you can load them with things like Pales rails or isometrics. To do so, you're going to find a yoga block. You're going to glue your calf to the yoga block. It's going to help you get a little more feedback as to when you're using your shin or your hip to compensate. Now we are going to think about the movement coming from our heel. So your heel is doing the movement. We want to make sure that we are not just moving and rotating our foot and toes. All we're going to do is go into full eversion, which is rotating that heel out, followed by full inversion, rotating that heel in. You're just going to go back and forth, squeezing maybe for a little more range of motion, or maybe you're just feeling the sensation of the muscle that is doing the movement, maybe contracting a little harder, maybe getting another degree or two with every rep, or maybe you're just working on doing the movement really slow and recruiting less of your knee or your hip. Only you are gonna know where you are. You should do around 10 to 15 repetitions of this. More is great for getting the skill down. Repetitions are always better for getting better movement. As you're working through this, you're making sure to avoid any closing angle pain. Closing angle pain for inversion would be on the inside of the ankle, and eversion would be on the outside of the ankle. If your ankle bothers you in this position with your foot up too far, then please just make it pointed or leave it relaxed. You can do this in varying degrees of plantar flexion or dorsiflexion, which is ankle up. It's just going to be which you prefer, or maybe a few in each. But give those a try and you might be surprised how much better your ankles feel.